Hi, my name is Caitlin Kirby Winters. This is my physical assessment video for my physical assessment class for fall of 2014. The person that is playing my patient is my mother, Sherry, and the person videoing the assessment is my husband, Brian. Here we go.
Okay, so the first assessment that we're doing is the eyes. Alright, so no, you don't take off your glasses yet. You're going to check the visual acuity. And you check that first by having someone read something up close. This test is their near vision. So what does that say?
Sensory function.
Okay. You might have them read more than just a couple of words. And then you're going to check their distance reading. So here's my Snellen chart. Okay? And you're going to have them ask them what it says at the top.
Snellen.
Or you could have them, if there's another sign, you can have them read the words that are on the board. Sometimes in the hospital they've got those boards up with the date on it or something. Alright, so to do a visual acuity test with a Snellen chart, you're going to have them ideally be 20 feet away. We're going to pretend in this case. And you are going to have her cover her eye with an opaque card, in this case her hand, with one eye. And then you're going to have her start at a line. So I'll say, read all the letters in this line.
CSFOMDXR.
Okay, so since you got all of them, we'll go down one and try it.
VXSTRNOKL.
Okay, and then we can switch to the other eye. And then let's say that we start right back here.
CSFOMDXR.
And let's just say that she didn't get all of those right, then you would move up until she got a row where she got all or most of them right. And so, since she's at 20 feet, or we're pretending that she is, we're going to report her vision at a fraction of 20. So, if her vision was 2200, then it would be that she read at 20 feet what most people, or the average person, could read at 200 feet. Alright. Then the next part of the vision is peripheral vision. And so you test that with a, I missed the word, confrontation test. Okay. So the way you do that is you have her cover an eye, in this case her right eye, and I'm going to cover my left eye with my right hand. And then you're going to bring your arm around. And so whenever she sees your finger, she's going to say something to you. And if she sees it about the same time you do, then you can kind of guess that her peripheral vision's okay. And if it's delayed in some way, then you might think that something was wrong. So,
Now.
Okay, so I saw it about that time, and we were guessing that her peripheral vision is okay. Okay, so the next part is the external examination of the eye. So in this case, you're going to have her remove her glasses. The first thing you're going to check out, can you see? Is her eyebrows. Okay, so you're going to look at the hair on the eyebrows. You're going to see how much there is, how coarse it is, and if it extends beyond the eye or just before the eye. If the hair is really coarse, or if it stops before the end of the eye, then those are signs of hypothyroidism. Excuse me. And if they're particularly thin, then you might ask if they wax or overpluck their eyes, which this is my mom, and she did back when she was a teenager. So then on top of the eyebrows, you're going to look the periorbital or the orbital area. Lift your head up a little bit. Thank you. And you're going to look for edema, which there isn't any, but if you do see any, then that's a sign of something like thyroid eye disease, or especially in the youth, it could be a sign of renal disease. You're also going to look for lesions, and something that you might particularly notice around the nasal area on the upper or the bottom portion of the eye would be xanthelasmas, and those are little areas of cholesterol that kind of form a little calcification, I guess, and that is a sign of abnormal lipid metabolism. Okay, next you're going to move on to the eyelids. So you're going to have her close her eyes, and you're going to make sure that they don't trim her on each side. If she's got really apparent tremors, then that could be a sign of hyperthyroidism. You're also going to make sure that the eyelid covers the eye completely. In this case, it does. And you're going to have her open her eyes wide. Make sure that she's able to do that. You're also going to make sure that, or you're going to check and see if the eye is inverted or everted. So if it's inverted, then lots of times those people are prone to, if it's inverted, lots of times those people feel like they have foreign bodies in their eyes because the hair will scratch the cornea. Or if it's everted, then those people tend to have excessive tearing. You're also going to look for redness, flakiness, crustaceans around the eyelids. That's usually something like allergies. Next, you're going to look around the eye for a red lesion, or even sometimes the same color as the skin. And that's something like a stye, and a stye is the inflamed eyelash follicle. So in this case, she doesn't have any. You're also going to look and check for ptosis. So in this case, can you see her eyes?
Mm-hmm.
Okay, so in this case, you expect that top eyelid to cover the iris to some degree, but if it comes down over the pupil, then you're thinking something like ptosis. And that can be a paresis of the branch of the third cranial nerve, or it could be a congenital or an acquired weakness in the levator muscle for the eye. Okay. And I think that's all on that part. So next you're going to do is palpate. Okay, so you're going to have her close her eyes, and you're going to gently touch to make sure that you don't feel any hard lesions around. Alright, in this case you don't. You're going to have her open her eyes. Alright, you're going to come close. Alright, so you're going to open, and you're going to make sure that the conjunctiva is transparent. In this case it is. You're also going to look at that lacrimal sac. Make sure that it's not enlarged. It's not. The sclera are white. They are. If they're yellow, it's a sign of liver problems. And you're also going to, if they're red or something, a hemorrhage, that can be a sign of a lot of different things, but that's an abnormality. Okay. Next, you're going to look, shine a light on the cornea and make sure it's clear. And it is, you can see. And you can also do the cornea test with a cotton ball. And so you're going to have her open her eye, which is really hard. And you're going to touch it with the cotton ball. And the proper response is what she did, was the blinking. And that, an abnormal response would be either delayed or not blinking whenever the cornea was touched. You need to come back closer. Alright, so you're going to make sure that the lens is clear. It is. You're going to look at the pupils and the iris. The iris is round, and there isn't really any abnormalities there. I mean, it's just round. The pupils you want to look at, you want them to be round and equal and regular, which means they're not irregularly shaped. You're going to check for response to light. So you can obviously see when I shine a light in her eye that her pupils constrict. Something else that you can notice whenever I shine a light in her eye is that the opposite pupil also constricts. Can you see that? Okay. That is the response to light, and that is the appropriate response to light. So if her pupils didn't constrict, or if this one constricted and then her right pupil stayed the same, then that would be considered abnormal. Okay, back to the lens. They are clear. If they were opaque, that's a sign of cataract, obviously. And we'll move on to EOMs. Okay, so with EOMs, you're going to have her look at the end of the pen light, and you're going to do the cardinal signs. So you're going to have her follow the end of the pen light with her eyes, and you're going to hold her chin so she can't move her head. You're going to any abnormalities there. I mean, it's just round. The pupils you want to look at, you want them to be round and equal and regular, which means they're not irregularly shaped. You're going to check for response to light. So you can obviously see when I shine a light in her eye that her pupils constrict. Something else that you can notice whenever I shine a light in her eye is that the opposite pupil also constricts. Can you see that? Okay. That is the response to light, and that is the appropriate response to light. So if her pupils didn't constrict, or if this one constricted and then her right pupil stayed the same, then that would be considered abnormal. Okay, back to the lens. They are clear. If they were opaque, that's a sign of cataract, obviously. And we'll move on to EOMs. Okay, so with EOMs, you're going to have her look at the end of the pen light, and you're going to do the cardinal signs. So you're going to have her follow the end of the pen light with her eyes, and you're going to hold her chin so she can't move her head. You're going to Alright, and so, that was weird, I'm sorry. She did that appropriately. The abnormal would be nystagmus. I can't say that word, I'm sorry. I'm going to get points taken off on that, sorry. And that is right. And you're also going to make sure that you're going to hold her head and check for the lateral. So you're going to make sure that she can see over here, and then she's going to see over here, in which case she does just fine. Alright, up next is the ophthalmoscope exam. In this case, we're going to draw up a chair. Alright, so you want to use the same eye as her to examine. So if you're checking her right eye, you're going to use your right eye to check. Okay, and you're going to turn it on. Okay, it is on. And you're going to start back about 12 inches, I guess, about a foot. And you're going to look through, which I have to do this side because I can't see. So we're going to do this side. Alright. And you're going to look through, and you're going to look for the red reflex, and when you find it, you're going to go closer, and if you lose it, you can always come back out and start over. But you are looking for the blood flow to the retina, and typically you'll find a branch of vessels that are close to the optic disc, which is a landmark of the optic disc. Okay, abnormals are Dretzen bodies, which are those small spots that you might see in the retina, and they get larger as you age, and they are related to senile macular degeneration. You might also see hemorrhages, which can be any color or size, depending upon the reason they're there or where it is.